Good morning po sa lahat, lalong-lalo na po sa lahat ng nakikinig dito sa Albay PIO Net TV, especially dun sa mga katrabaho ko sa Albay Veterinary Office. So today, I will share an information regarding common rainy season diseases in animals. By the way, I'm Dr. FRANZ V. COLAMBO from the Albay Veterinary Office, Albay Park and Wildlife. So to start, as an introduction, so the monsoon season in the Philippines provides a welcome break from the summer heat, but it also raises the risk of a variety of common diseases known as rainy season diseases. So not just to us humans, but also to our pets. So hindi lang tayo yung naapektuhan ng rainy season na to, itong monsoon, itong wet season natin sa Philippines. So from summer season to rainy season na tayo. So understanding these diseases and how to avoid them might help you and your fur babies to stay healthy throughout the rainy season. So ang pinakauna dyan, kung ang sa ating mga tao, ang threat during rainy season is dengue fever. Sa aso naman, may tinatawag din, aso't pusa and other animals, farm animals, may tinatawag din na dengue sa kanila. Pero not necessarily same with humans na ang nagkukos ng dengue fever sa human. So dito sa animals, iba naman. Meron silang mga mosquito-borne diseases, especially kasi sa dog, kasi mas wide yung scope nito, pero mas nag-focus na lang ako sa dogs kasi yun yung usually na present sa mga clinics, vet clinics, and also to our office. So what is mosquito-borne disease? Mosquitoes play a crucial role in the life cycle of the heartworm parasite. Yun yung isa. When a female mosquito bites an animal with heartworms, dala-dala ng mosquito yung heartworm, it ingests tiny larvae of the parasite, which then develop into infective larvae within the mosquito. And then these larvae can be transmitted to an animal such as dogs when the same mosquito bites it. So without the mosquito, heartworm larvae cannot develop and infect dogs. So mosquitoes can transmit infections including fatal consequences to dogs through their bites. Symptoms of these diseases may not appear until the infection is severe and can include digestive, respiratory, and neurological signs. Yun yung pwedeng maging effect niya. So ano yung mga symptoms of mosquito-borne diseases in dogs or sa ibang animals? The symptoms of a mosquito-borne disease extend beyond the body's reaction to the bite, such as itching and lumps on the skin. So normal naman na pag kinagat ng insekto, nagkakaroon ng mga lumps and itchiness yung mga aso natin and other pets. These symptoms will go away, but if your dog has contracted a mosquito-borne infection, they may emerge quickly or gradually. So symptoms of a mosquito-borne disease may include among others, fever, lethargy, nasal and ocular discharge, yung pagmumuta, and pagkakaroon ng sipon-sipon, tapos panghihina, yung lagnat, unusual bleeding, kaya nagkakaroon sila ng anemia, anemic yung mga aso natin, maputla, swollen lymph nodes, yung mga kulane, lumalaki dahil nga may ongoing infection yung katawan. Yun yung natural reaction para mag-fight back yung katawan ng aso or ng pets natin. And weight loss kasi during this illness or disease, wala silang ganang kumain. So types of mosquito-borne diseases. The types of diseases that mosquitoes can transfer to dogs include parasitic infestations, viral infections, and bacterial infections. So the most common include heartworm, West Nile virus, Eastern equine encephalitis virus, Venezuelan equine encephalomyelitis virus, and tularemia. So una, ito yung mas nakikita natin na infection sa dogs and rarely sa cats. Heartworms are dangerous parasites that reside in the hearts and blood vessels of the dogs. So kung makikita nyo dyan sa screen, may picture dyan, yung nandyan, cross-section ng heart, tapos maraming nakadislodge na heartworm sa dogs. So as they multiply, they can block blood flow to vital organs, disrupting heart function. Kaya nagkakaroon ng mga cardiac arrest yung mga asong may heartworm infestation. Additionally, they can infiltrate the lungs, liver, and kidneys kasi nagmamigrate sila pag wala na sila masyadong space sa heart, magmamigrate sila sa other organs. Due to the difficulty of detecting infestations, symptoms may not appear for years. Kaya ang iba, matagal bago ma-diagnose, especially dito sa Philippines na hindi tayo mahilig na ipa-consult yung pets natin regularly. So usually ang nangyayari, pinapa-consult lang natin pag may nararamdaman na. So sa case ng heartworm, nagmamanifest yung mga signs and symptoms ng disease na to. Then magpapakita siya nitong mga coughing, shortness of breath, and anemia. Means adult na yung mga heartworm or meron ng infection or infestation. So pwedeng nagpo-progress na siya, or yung mga eggs or yung mga larvae nagmamigrate na sa iba-ibang organs like heart, lungs, liver, and kidneys. So another type ng mosquito-borne disease is the West Nile virus. This virus is spread from birds to mosquitoes and then to other animals, especially horses. Kaya sa equines naman, sa horses naman itong mosquito-borne disease na to. While dogs often show no symptoms, the virus can pose a significant risk for neurological issues in young, old, and immune-compromised dogs. So rare naman na magkaroon ng infection ng mga aso nito, pero pag once na nagkaroon, especially sa immune-compromised dogs, sa mga mahina yung immune system, so possible na mag-cause siya ng neurological issues sa brain. Possible na magkaroon ng seizures or yung frequent na umiikot-ikot lang siya, or yung ulo niya nakasandal lang sa pader kasi mayroon ng mga tama sa brains kasi nagba-migrate na doon yung or nag-develop na doon yung viral disease. These issues may manifest as difficulties with movement, convulsions, tremors, sickling, and a reduced appetite. It's important to be aware of these risks and take appropriate precautions to protect our furry friends. So next type of mosquito-borne disease, Eastern equine encephalitis virus. Sa horse pa rin siya, but this virus poses a significant threat to passerine birds. So sila yung pinagmumula ng mosquito. So kakagatin sila ng mga lamok. Then pag yung mga lamok naman napunta sa farm natin, especially sa horses and other equids like donkeys, yun, nagkakaroon din ng infection. And it has been documented in cases involving dogs. So referred to as sleeping sickness, this virus is notoriously difficult to identify and has the potential to be fatal. Early signs such as fever and diarrhea can swiftly escalate into uncontrolled eye movements, depression, and seizures within just 1 to 2 days. Ang tinatarget nito is the brain. Neurological sickness kasi to. Next one is the Venezuelan equine encephalomyelitis virus. So ito naman galing siya sa wild rodents, which can lead to a decrease in both red and white blood cells in dogs. So pwede niya ma-infect ang dogs. While some dogs can develop antibodies and show no signs of the infection, others may suffer from symptoms such as fever, weight loss, and diarrhea, which can progress to serious neurological issues such as muscle spasms, incoordination, and convulsions. Unfortunately, death often follows the onset of these neurological signs. And next one, the tularemia. So, ang nagkakos nito yung Francisella tularensis. So, it is a bacterium responsible for a dangerous disease commonly found in rabbits and rodents. So, sa mga daga and rabbits. Once inside an animal, the bacteria targets the lymph nodes or yung mga kulani and can lead to a severe systemic infection affecting the lungs, liver, spleen, and bone marrow. This can result in the formation of masses and abscesses in the liver. So magkakaroon ng mga bukol-bukol yung liver ng animal. The disease can be transmitted to dogs through the ingestion of an infected animal. Pag nakain ng dog natin yung infected rabbit or infected rat or mice, or via an infected mosquito bite. So yun. Warning signs of this potentially fatal disease include painful lymph nodes, high fevers, pain, jaundice or pagiging yellow ng katawan, and organ failure. It is crucial to be aware of these symptoms and seek prompt medical attention if needed. So, these are the causes of mosquito-borne diseases. Mosquitoes are more often than just pesky insects. They can transmit dangerous diseases such as yung mga nabanggit kanina. When a mosquito feeds on an animal, it can pick up viruses, parasites, or bacteria from the animal's blood, becoming infected itself. The infected mosquito can spread these harmful agents to other animal it bites, potentially leading to the transmission of diseases. It's important to note that while mosquitoes can transmit a variety of blood-borne diseases, not all of these diseases can infect dogs, making it crucial to take preventive measures to protect our beloved pets. Sa pag-diagnose naman, when your pet shows symptoms, the veterinarian will conduct a thorough physical and neurological exam, blood tests, and possibly x-rays and other tests to check for heartworm and other potential causes. Kasi nga, usually yung heartworm disease, nagdi-dislodge siya anywhere sa organ ng animal or especially sa dog, lalo na sa heart. Kaya yun din yung pinanggalingan ng name, the heartworm. Urine and fecal tests may also be conducted, and diagnosing mosquito-borne viruses can be challenging, but a presumptive diagnosis can often be made based on visible symptoms. Yung based dun sa mga nabigay na symptoms kanina. Treatment of mosquito-borne diseases. If your dog is diagnosed with heartworms, treatment is available but comes with risks. Symptoms often indicate an advanced and potentially fatal condition. Injectable medication can kill the heartworms but may cause severe coughing as the adult worms migrate to the lungs. So, doon naman pupunta yung heartworm sa lungs when giving certain medication to treat the heartworm infestation like ivermectin. Complete rest is necessary, and any adverse reaction must be reported to your veterinarian. In advanced cases, treatment may only address organ damage with antibiotics, anti-inflammatories, and supportive care. After eliminating heartworms, continued care for your dog can include special diets, diuretics, and various heart medications to address any organ damage. There are no cures for West Nile virus, Eastern equine encephalitis virus, or Venezuelan equine encephalomyelitis virus, kasi mga viruses sila. No specific treatment. Supported treatment lang, including fluid therapy and medications and antibiotics, can help manage the conditions. Sa tularemia naman, it can be treated with aggressive supportive care during hospitalization, including antibiotics, fluid therapy for the best chance of recovery, and early treatment is crucial for the mosquito-borne diseases. So, under recovery of mosquito-borne diseases, your dog's recovery depends on the type and severity of the disease. Administering treatment early improves the prognosis or yung kakahantungan ng disease na yon. Follow all vet instructions after heartworm treatments. So, use routine heartworm prevention after your dog is cleared of worms. May mga nabibili naman sa mga vet clinics like Heartgard and the ivermectin as preventive measure na pwedeng mga drugs na ipainom sa aso to prevent these mosquito-borne diseases. Vaccines are available for the West Nile virus and Venezuelan equine encephalomyelitis virus to protect your dog, kasi pwede nga na from horse yung lamok pwedeng dumapo sa aso natin and ma-infect yung dogs. Although hindi naman talaga sila main reservoir or main host ng virus na yun. Reduce exposure to mosquito-borne viruses with management techniques such as eliminating standing water, yung mga stagnant water natin sa bahay, and using pet-safe mosquito repellent. So, available naman siya sa mga vet clinics, mga repellent sa pets natin, sa both cats and dogs. Yung next common disease during rainy season, lalong-lalo na earlier this quarter na meron tayong mga typhoon pagbaba, especially sa NCR. So, leptospirosis infection in animals. So, isa rin siyang threat sa pets natin. Leptospirosis can affect people and animals, including pets, farm animals, and wildlife. It is spread through the urine of infected animals, contaminating water and soil. Animals can become infected through contact with contaminated urine or body fluids. Symptoms can vary widely, and some animals may not show any at all. Sa dogs and cats, almost every dog is at risk of leptospirosis regardless of their environment. They can contract it through contact with infected urine or water, bite wounds, consumption of infected body tissues, or being born to an infected mother. So, kung pregnant yung dog natin, then na-infect siya ng leptospirosis, possible na infected na rin yung mga puppies niya once na manganak siya. And dogs roaming in wildlife areas or frequenting dog parks are particularly vulnerable. Kasi sa wild naman, di naman natin makikita kung mga infected yung mga nandun. Especially dun talaga nanggagaling yung mga bacteria and viruses. So, much better na during rainy season, nasa loob lang ng bahay yung mga pets natin. Early detection of leptospirosis symptoms in dogs is crucial. So, look out for signs such as fever, depression, lethargy, or yung panghihina nila, loss of appetite, joint or muscle pain, eye and nasal discharge, changes in urination habits, and jaundice, or yung pagiging paninilaw ng katawan ng aso natin. And yung frequent urination, ihi sila ng ihi. If left untreated, and lagi rin silang uhaw. If left untreated, infected dogs may experience vomiting, dehydration, and back pain due to kidney failure within just a few days. So, yun yung effect ng leptospirosis. Possible na magka-kidney failure yung mga pets natin. So, don't hesitate to seek veterinary care if you notice any of these symptoms in your dog. Even though cats can contract leptospirosis, they tend to show fewer symptoms and demonstrate more resilience to the disease. Kaya may mga nagtatanong kung bakit yung pusa, kahit paboritong paglaro or hulihin yung mga daga, hindi nagkakaroon ng lepto. Kasi meron silang parang yung immunity or resilience to the leptospirosis. However, infected cats can still spread leptospirosis, so carrier pa rin sila, although hindi sila affected nung disease, so in their urine for extended periods. Kaya kung may mga kasamang pusa sa bahay yung aso nyo and yung may mga daga, tapos nanguhuli lagi yung pusa nyo ng daga, tapos infected ng leptospirosis, possible na mahawa ng pusa yung aso. Lalo ko nag-share ng same water bowl. or food bowl. Vaccines to protect both dogs and cats from leptospirosis are readily accessible in the Philippines. Yun yung mga 5-in-1 natin, 4-in-1, and 6-in-1, 7-in-1 sa vet clinic. So, included na dun yung vaccine against leptospirosis. Sa farm animals naman, farm animals are susceptible to contracting leptospirosis through various means: breeding with infected animals, direct contact with infected urine or contaminated water sources, bite wounds or skin damage from other animals, especially from rodents, bite wounds, consumption of infected animal body tissues and organs, so being born to an infected mother, eating infected animal body tissue and organs, being born to an infected mother. Leptospirosis sa cows is a significant concern, impacting their reproductive health in two distinct ways. So, may chronic infection, also known as silent infection. So, the more prevalent form and often leads to pregnancy loss and recurrent heat after conception, so abortion. On the other hand, acute infection naman, while less common, can result in spontaneous abortions at any point during pregnancy and the birth of weak offspring. Kung maging successful naman yung panganganak, weak yung offspring, and eventually pwedeng mamatay. Additionally, lactating cows may produce milk tinged with red due to the presence of blood due to the infection. So, yung sa mga dairy farm natin, rejected na kagad yung milk na mapoproduce ng infected na cow of leptospirosis. Sa goats and sheep naman, sheep are less susceptible to leptospirosis compared to cows and pigs, as they rarely show symptoms. However, goats are more susceptible and often exhibit symptoms of the disease. Signs of leptospirosis in goats include abortion, stillbirth, birth of weak offspring, and infertility. So, more on sa reproductive diseases. It's important to be aware of these signs and take necessary precautions to protect the health of these animals. Sheep, although rarely showing symptoms, can still become infected with leptospirosis, making them resistant to the disease compared to cows and pigs. Pero, pwede sila maging carrier. Recognizing the signs of leptospirosis in goats, such as abortion, stillbirth, weak offspring, and infertility, is crucial. So, fortunately, there is a vaccine available to control leptospirosis in ruminants, and antimicrobials can effectively treat diagnosed animals, such as doxycycline. Implementing strong animal management practices is essential in preventing and reducing the spread of leptospirosis. So, sa farm, dapat may pest control and biosecurity measures. Sa horses naman, ang leptospirosis is prevalent threat, and look out for signs such as fever, recurring eye infections, abortion, and acute kidney failure. Fortunately, there's also a vaccine that effectively prevents severe infection in horses. So, need din ng biosecurity measures and pest control sa farm, lalo na sa horse stable. Sa domestic pigs naman and wild pigs or feral swine, leptospirosis is a widespread disease affecting pigs and wild pigs globally. So, it can result in significant reproductive setbacks, including abortion, stillbirths, and the birthing of weak piglets. So, those who come into contact with infected feral swine, such as hunters, lalo na sa upland, mga indigent mga kababayan, are at risk of contracting leptospirosis. So, additionally, feral swine can spread the disease to pets, farm animals, and other wildlife. The signs of infection in pigs and feral swine include fever, abortion, stillbirth, weak or sick piglets at birth, jaundice, yellowing of skin, and acute kidney failure. Vaccination is a crucial preventive measures for pigs while implementing strong livestock management practices such as biosecurity measures is essential in curbing the spread of leptospirosis. Sa marine mammals naman, mayroon mga incident din na na-infect sila ng lepto. So, other susceptible marine mammals include the northern fur seal, elephant seal, and Pacific harbor seal. Baka sa Ocean Park meron ito. Symptoms include increased drinking, depression, reluctance to use hind flippers, and acute kidney failure. So, if you find a stranded or dead marine mammal, stay away from the animal, keep your pet's leash, and contact the local stranding network para hindi mahawa yung pets natin. Treatment in animals. If you suspect an animal may have leptospirosis, don't hesitate to get in touch with a veterinarian immediately. The veterinarian has the expertise to conduct tests and start treatment promptly if the disease is confirmed. Early treatment with antibiotics can speed up the recovery process and minimize the risk of severe organ damage. Additional treatment methods such as dialysis and fluids may also be required for the animal's well-being. So prevention. To prevent leptospirosis infection, control rodent problem as they can spread bacteria. Vaccinate dogs, cats, cows, sheep, goats, pigs, and horses against leptospirosis, although the vaccine doesn't offer full protection to different bacterial strains kasi marami pong strains ng leptospira. For farm animals, use a combination of vaccination and livestock management practices and seek recommendations from a veterinarian based on your location, number of animals, and risk factors. So, yan, almost the same naman lang to avoid or prevent the spread from animals to people. So, avoid contact with the animal's urine or blood until it's been treated. If you need to handle animal tissues or urine, cover any wounds and wear protective clothing such as boots kung lulusong sa baha. Always wash your hands after handling your animals or anything soiled by animal waste. Use an antibacterial cleaning solution or a diluted bleach solution to clean contaminated surfaces. And ensure your animal completes all prescribed medication and follow up with your vet once na may contact yung pets natin sa may infected ng leptospirosis, especially rodents. Next disease naman during rainy season is the influenza infection in animals. So just like sa humans, possible din na magkaroon ng respiratory illness yung mga pets natin, magkaroon ng sipon, ubo. So pwedeng ma-affect lahat ng kinds of animals such as birds, mammals, pwede rin nga wild aquatic mammals like seals and whales, and farm carnivores. So sa mga influenza viruses, type A virus is the most significant in terms of cross species infection. So pwede niyang ma-infect yung multiple species. So zoonotic ang influenza, some are zoonotic. Zoonotic means from animals, pwedeng mapasa yung sakit sa humans. So it is important to recognize that there are no absolute barriers between influenza viruses in different species kasi pwede niya ma-infect yung multiple species. So vigilant surveillance of animal populations and appreciation of the zoonotic nature of influenza viruses are pivotal steps in preparing for and combating future influenza pandemic. So recently nagkaroon tayo ng false alarm na avian flu. So buti na lang negative naman. And in pigs, influenza typically causes explosive outbreaks of acute respiratory disease characterized by fever, lethargy, nasal and ocular discharge, coughing, difficulty breathing, and loss of appetite. Although mortality is low, swine influenza may lead to economic losses due to delayed weight gain. And additionally, dito, yung kinakarap natin ngayon, the threat of African swine fever. So, sa Poultry naman, sa mga birds, avian influenza infections in birds depend on the species and virus pathogenicity. Yung H5 and H7 subtypes cause clinical disease in chickens and turkeys, while ducks and most other waterfowl have subclinical infection. So hindi masyadong active yung disease sa kanila, o hindi nakikita. So dito naman, yung highly virulent strains cause fatal systemic disease known as fowl plague, characterized by edema, pamamaga ng muka ng ibon, hemorrhages, and central nervous system infection. And then sa horse, equine influenza, a serious condition then caused by two subtypes of influenza A viruses, H7N7 and H3N8. So may high fever din sila, nasal discharge, and a harsh dry cough. So pwede mag-develop ng pneumonia and encephalitis. So regular monitoring and prompt action are vital for safeguarding the health of these animals. So in 2004, nagkaroon din ng discovery na mayroong influenza A virus din, H3N8, sa dogs. So possible na magkaroon din ng pet dogs natin. And transmission naman from animals to people, wild birds are the main natural reservoir for all subtypes of influenza A viruses. So yung avian flu. And sa pigs naman, usually minimal lang yung nagiging effect sa atin, sa humans, pero malala siya within the sa species nila, sa swine. Pigs can serve as mixing vessels for different influenza viruses. Pwede sila maging carrier ng different influenza viruses. So yan, ito yung meron ang avian influenza, the highly pathogenic avian influenza A H5N1 virus, or the HPAI H5N1. Yung nakakahawa sa tao. Ang dermatophilosis naman, or rain rot, nagkokos din siya, especially ng skin diseases, fungal infection sa mga pets natin. So yan. So and then tick and flea infestations. Alam naman natin na uso rin sa mga aso ang tick and flea infestations, yung mga garapata at pulgas. So nagkokos siya ng pangangate, pamumula at mga butlig-butlig, mga lumps sa skin ng aso at pusa natin. So how to control? It's essential to control fleas and ticks to protect your pet. Monthly topical treatments like sprays, oral medication, yung mga fipronil, NexGard, shampoos and collars are the first line of defense. So pwede natin siyang makuha sa mga veterinarian natin or sa vet clinic para ma-prevent or ma-control yung tick and flea infestation sa pets natin. So ways to keep your pets healthy during the monsoon or the rainy season: keep them dry, protect your pet from the perils of rainwater. Downpour can lead to skin infections and discomfort. So ensure your pet has a dry, warm place to rest and dry them with a towel after rain, and give them a cozy, sheltered spot to relax. Protect them from moisture para maiwasan yung mga fungal and skin diseases and bacterial infection also, pati parasite infestations. So invest in a waterproof raincoat or use an umbrella to shield your pet from getting wet during outdoor activities. So again, keep them dry. Maintain good hygiene, yung proper grooming, and keeping their fur clean and free from tangle. So para maiwasan natin yung pagiging moist ng fur or skin, para maiwasan yung mga fungal and bacterial infections. Prevent tick and flea infestations to safeguard our pets from parasite infestations, para naman hindi sila nagkakaroon ng skin irritations and skin itchiness. Keep them away from harmful substances, especially dahil nga uso yung mga ganitong tick and flea season during rainy season. Syempre gagamit tayo ng mga chemicals, yung spray. So iwasan natin na magkaroon ng access yung pets natin sa kanila para hindi sila ma-poison. Maintain a balanced diet para healthy ang mga pets natin. So due to decreased physical activity, they may require fewer calories. And avoid excessive treats and maintaining portion control is key for ensuring a balanced diet for our pets. Provide adequate exercise. So if it's safe to do so, taking a short walks during rain break is important to ensure your pet gets some physical activity. Prevent waterborne diseases such as leptospirosis. So lagi nating linisan yung food bowl and water bowl ng pets natin kasi baka during the night may mga umiinom na mga rodents or mga pests and makontaminate yung natirang pagkain or yung food bowl nila and yung water nila, drinking water. So yun lang, and thank you for listening. So I hope na maging safe lahat, especially our furry friends. So thank you.